The Aged Care Royal Commission's final report made 148 recommendations yesterday to overhaul the overwhelmed and underfunded sector. Pat Sparrow is from the Aged Care Collaboration Group, which represents more than 1,000 organisations delivering aged care either at home or in aged care facilities, and she joins us now from Canberra. Pat Sparrow, welcome. So this 2-year investigation concluded the extent of substandard care in Australia's aged care system is inexcusable. At the end of this process, do you offer an apology for what has happened in your sector over recent decades?
Good morning, Joe. Thanks for having me on. It's really important that the Royal Commission report has now been released publicly, and obviously the instances of care that have been highlighted here are unacceptable, and we do accept as providers that we need to do better and to do more and to do it quickly.
And do you offer an apology?
We do. We are very concerned that people have had that and apologise to those who've had less than the care that they deserve.
How did it get so bad that 1 in 3 experienced substandard care and up to 18% had been physically or sexually assaulted?
I think what we see is, as I said, we acknowledge and accept that there are instances of substandard care, but we also see in the Royal Commission report and through the Royal Commission hearings that there are a lot of systemic issues that need to be addressed to make sure that we can deliver the quality of care that people are expecting. We've had over 20 reviews over 20 years where improvements have been suggested to the system. Both governments, successive governments, both sides of politics, have picked and tinkered around the edges and made some changes, but we haven't actually undertaken fundamental reform. And what's really critical now is the Royal Commission's laid out a blueprint for reform. What's really critical now is that we all commit to that and make sure that we make the sector and the services that we provide the very best they can be.
One recommendation is that from July next year, each resident should have access to 200 minutes with staff per day, and 40 of those should be with a registered nurse. Is that achievable? Can you commit to that now?
So certainly what we want to be able to do is employ more staff. We know that we need more staff, and we know they need to be better paid and better trained. So it is what we want to do. The issue that we will have with 64% of aged care facilities operating at a loss, climbing up to 78% in rural and remote areas, is we want to be able to do that, but we're going to have to address the resourcing of the system to ensure that we can.
So how much more funding will be needed to achieve that mark by July next year?
The Royal Commission report doesn't actually go into that, so I think this is part of the conversation that's to come. An interesting figure for people to be aware of, though, is that in Australia we spend 1.2% of our GDP on aged care. Other countries in the OECD, and the average that they spend is 2.5%. So I think we are looking at significant increases in resources, and it's worth it because we have to make sure that older Australians are getting the care that they need.
So realistically, would that be achievable by next year? Every resident in an aged care facility in Australia getting 200 minutes of staff time per day, 40 of those with a registered nurse?
What we need to do is try and achieve that, but we're going to have to recruit. We're going to have to recruit workers, we're going to have to be able to pay workers, and we're going to have to make sure they're well trained. So there are a number of things that need to be done, and a plan is being laid out. I know that's the recommendation, but a plan will be laid out about making sure that we can achieve those things.
If you're talking at this stage about recruiting and training workers to get to that stage, is that really realistic to get to that mark by July next year or not?
Well, I guess what I'm saying though is it's the reality, right? So we need to have more staff. We constantly try and attract staff. We need to triple our workforce by 2050. So it is a challenge for us, but we're committed to doing everything that we can to achieve the quality of care that we want to deliver and that the community expects.
Would you be open to a publicly available star rating system for facilities that grades providers on staffing levels and feedback from clients and other quality indicators?
Yes, we think transparency is absolutely critical. We want to make sure that the information that's provided is meaningful. There can be a lot of information provided which to someone looking at outside from the system doesn't actually mean very much. So I think the challenge with this is to make sure that it's really good information, that people in the community can understand exactly what it's telling them, and that's something that we are working towards.
Yeah, so just confirming you will accept this publicly available star rating system for facilities?
Do you know, we're open to all of the recommendations, but what we have to do is work through in a positive way, in a good way, what we can do, by when. It's going to take government looking at what it needs to do and committing resources as well as providers.
So you say you're open to that, but will you commit to that now or not?
What we need to see now is what the government's going to actually do in its response. It did a start to reform yesterday.
But can't you just say, after all this heartache and all these terrible stories that we've seen over the years, Patricia Sparrow, I just want to try and get some commitments now if we can. And it sounds like you're not willing to commit now to this star rating system for facilities.
I don't think you can say that we're not willing to commit. I think what we're saying is we are looking at all of the recommendations.
But that's not committing to it.
Well, at this stage, what I can say to you is we're open, we're willing, we're wanting to work with government and.
But haven't we had enough time to say we're open and willing? People want action now.
I understand that, and we want action as well. We have to, though, make sure that we get the big picture reforms that we need. Not all of that is in the hands of providers. We actually need government to make commitments now, and they'll be responding in the budget.
Yeah, but I'm not talking about a big picture reform in this particular question. There's a recommendation that there be a publicly available star rating system for facilities, and will you commit to that now?
And I think what I'm saying is we think that's a really good idea, and we want to work and make sure that it's meaningful information for people.
Okay, on accountability and transparency in relation to funding, staffing and operations, is it reasonable to expect providers to produce an annual report to be published on the My Aged Care website?
Yes.
Yep. Okay, and should the aged care sector be overseen and run by an independent agency outside the Health Department? This is one of those interesting recommendation situations from the Royal Commission where there was split opinions by the two commissioners. Do you lean towards one or the other? One was saying that over the last 30 years or so, there have been multiple, as you mentioned yourself, there have been multiple inquiries into the aged care sector, and they've all been resulted in recommendations under the work of the Department of Health. One of the commissions is saying that needs to be done with now, and there needs to be an independent agency overseeing the sector and regulating the sector, whereas the other commissioner is in favour of continuing to do it within the Department of Health. Do you have an opinion on that?
I thought there were two really important principles that were common across both of the recommendations from the commissioners, which were around independence and transparency. So I think now we need to look at which of those, or if it's a combination of both, is going to deliver that so that the community feels confident and we do all have transparency about how the system's managed and how the system's going.
Yeah, so you're not leaning one way or the other at the moment.
Want to work it through, given that we've got differing views, but what they're not differing on is that there needs to be independence and transparency, and we support that as well.
Yeah. And do you think this will need a levy or a rise in personal income tax? That's one of the other issues where there's a bit of a split in opinion. Yeah,
which is, unfortunate, and we don't want that to stop the reform from happening. I guess our focus is on whether it's a levy or how it's done, is that the funding overall for the system needs to be increased, and really it's a decision for government around how they do that, and we will support that because our concern is to make sure that we can employ more staff, train them better, pay them better, and just deliver better services. So however we do that, we will be supportive of that move.
And the Prime Minister in his media conference yesterday was talking about, his key principle was setting up a needs-based system rather than a system that focuses on the amount of funding going to providers. What did you think about his approach to that and what appears to be the key strategy with the new approach to aged care that will evolve in the coming years?
We absolutely believe that the system needs to be focused on meeting the needs of individuals, and that the funding needs to support that individual. So exactly how that works and how that supports making sure that providers are sustainable and are there to meet the needs will be a critical part of that reform. But in terms of focusing on the individual and their needs, that's a really, really important thing that we support.
Yeah. Okay, Pat Sparrow, thanks so much for talking to us this morning.
Thanks for your time.